Okay, well, good morning and welcome to our Swetland Seminar Series. We're so glad that you're joining us for our first seminar of 2022. So welcome. I know it's been a little while, so hopefully everyone had a wonderful holiday break and having a restful winter season. So we are going to jump right in if you want to advance the slide, Rachel. So we'll just go over brief housekeeping items before we jump into the presentation. So everyone will be muted during this presentation. If, of course, you have some questions or comments during the presentation, feel free to put them in the chat. And then we do welcome everyone to share their name and their organization that they represent in the chat box here as we get started and as we have more people joining with us this morning. So go ahead and if you feel free to share that. And then I also wanted to briefly mention the Swetland Center. This is our debut of our link tree. So this is actually a really neat platform that houses many important links to platforms that the Swetland Center uses and promotes. So I will be putting the link to our link tree in the chat. And you can also, if you feel inclined to do so, scan the QR code that's on your screen to visit the link as well. You'll see several, the screen will actually appear exactly how it is on the PowerPoint right now. And these are all links to different items on our Swetland Center website. And then you'll see with the red arrow there, February seminar links. So our presenters will be referencing some documents and items today throughout their presentation. And feel free to visit that February seminar link in order to kind of follow along and view what they will be referencing. And then we also invite you to also visit pages like our event calendar, which house all of our seminars, the registration links for those and the descriptions as well. So I will be putting that link tree in the Zoom chat. You can follow it like that, or again, scan your QR code on the screen. So without further ado, I will pass it over to our center's director, Dr. Darcy Freedman, to kick us off.
Great. Well, thank you, Lindsay, and good morning and welcome to our seminar. I'm Darcy Freedman, and it's my honor to serve as the director of the Marianne Swetland Center for Environmental Health since 2019. Today, we hope to take you on a journey highlighting what we've been up to in the center over the past year, while providing a roadmap for where we are heading with respect to our commitment to center racial equity and community engagement in the work of the center. Before we get started, we want to acknowledge the land that we are on at Case Western Reserve University, and recognizing the land upon which we reside, we express our gratitude and appreciation to those who lived and worked here before us, those whose stewardship and resilient spirit makes our residence possible on this traditional homeland of the Lenape, Delaware, Shawnee, Wyandotte, Miami, Ottawa, Potawatomi, and other Great Lakes tribes. We also acknowledge the thousands of Native Americans who now call Northeast Ohio home. Case Western Reserve University and the greater Cleveland area occupy land officially ceded by 1,100 chiefs and warriors signing the Treaty of Greenville in 1795. We recognize that in the times following this treaty that there have been many other people who tendered this land, and we pay homage to their commitment in caring for this sacred space. As a part of our racial equity and community engagement deep dive over the past year, which you're going to hear about more today, we have thought a lot about this statement and the importance of honoring history, including naming of historical wounds that must be healed as we work toward our goal of environmental health equity. I would like to take a moment of silence for each of us to honor the land we are upon across this virtual landscape. And if you have a land acknowledgement that you would like to share, feel free to post it in the chat. I will also share a link to the Facebook page for the Lake Erie Native American Council that highlights opportunities to engage locally by offering time, talent, and treasure. I'm going to go ahead and put that in the chat because I don't know if that's on the tree. So in the spirit of honoring history to guide future actions, I'd like to share about an upcoming book club we are hosting this summer with the Swetland Center in partnership with the Case Western Reserve University Social Justice Institute. We'll be reading Braiding Sweetgrass, written by Robin Wall Kimmerer, and we hope to use this time for co-learning, dialogue, and reflection about authentically honoring the land we are grateful to be upon through our work. And if you'd like to be added to the book club launch list, please direct message Lindsay Osborne. We also want to honor the shoulders we stand upon as we seek to advance racial equity through the Swetland Center. These 4 African-American leaders are Case Western Reserve University graduates and trailblazers in their respective fields. Dr. David Satcher received his MD and PhD at Case Western and served as the 16th Surgeon General for the United States. Mr. Fred Gray is a Case Western law graduate and civil rights leader representing Rosa Parks, Reverend Martin Luther King Jr., and the Tuskegee syphilis experiment victims in his career. Mr. Justin Bibb is a Case Western law and Weatherhead graduate, serving as we all know, the 58th and current mayor of the city of Cleveland. And Miss Stephanie Tubbs Jones is a Mather College graduate and Case Western law alumnus. She was the first African-American woman to be elected to Congress from Ohio. Again, we'd like to take a moment of silence to express gratitude for the transformational impacts of these leaders on our university, our community, our nation, and our world. So today we're going to go through this agenda. Starting off, we're already in our welcoming. Then I'm going to do a brief review of what we've been up to last year. And then the rest of the time, or the majority of the time, is focused on where are we going with respect to our commitment to racial equity and community engagement. You're going to hear from the team about how we got started, our process, the development of an action plan and sort of some of the pieces of the plan. And then we'll spend a little bit of time today in an interactive session thinking about collaboration for implementation of the plan. I'd like to publicly thank our Racial Equity and Community Engagement Task Force who led our efforts over the past year, and maybe they can wave in the Zoom window. Rachael Sommer, our Director of Operations and Partnerships, Tim Ciesielski, our Senior Research Associate, India Gill, a doctoral scholar in the center, and Sheena Fryerson, Community Engaged Research Coordinator. This dynamic team will be presenting in just a minute. So I'm delighted to share the 2021 annual report for the Swetland Center. Today, I don't have time to go over all of our accomplishments from last year, but I welcome you to peruse the annual report. And again, you can find a link to our report in the link tree posted in the chat. I want to offer a special thank you to Rachael Sommer and Lauren Vargo for their work in pulling together this beautiful report. And I also want to thank our team members, partners, and advisory council members who do the day-to-day collaboration to bring each of these highlights to life while we all try to navigate the pandemic. The Swetland Center is an academic research center housed in the School of Medicine at Case Western Reserve University. We have a three-pronged approach focused on research, training and education, and community engagement. And these center around the goal of advancing community system science for environmental health equity. Within the center in 2021, our work addressed three priority areas: food systems and health equity, which is the primary research focus of the center, COVID-19 and environmental health, and air quality and community health. This slide highlights existing projects within the Swetland Center, which include collaborations with community and stakeholder partners locally in the greater Cleveland area, across our state and nationally. I'd like to personally thank our 2021 funders listed here for their commitment to the mission of the Swetland Center. These funders support work that we directly lead here in the center related to our priority areas. And these funds also support work where we offer significant team science collaboration to integrate community engaged environmental health approaches into broader population health initiatives. So there's so much I could share about 2021, but I'm going to focus just on one story. In 2021, we responded to calls from our community partners to develop tools to translate our extensive food systems modeling research developed through the Modeling the Future of Food in Your Neighborhood study into community action. Last March through July, we pilot tested the Food Systems Change Fellowship, working alongside 5 community leaders, providing a test kitchen for developing their visions for community-driven food systems change. And you can see this figure here on the first stepping stone is a workbook that the fellows and members of the Swetland Center team co-developed that walks people through creating a vision for community-driven food systems change. We also translated insights from 3 years of participatory system dynamic modeling into a publication that was accepted in the American Journal of Clinical Nutrition, which is one of the highest rated nutrition journals. In this work, we unpack the black box of food system complexity and offer nutrition equity as a North Star to guide local food systems work in racialized urban neighborhoods within Greater Cleveland, as well as communities across the United States. Our team defined nutrition equity as having freedom, agency, and dignity in food traditions, resulting in people and communities healthy in body, mind, and spirit. And our team continued to push us to integrate our modeling insights into local discourse surrounding the election for the mayoral election for the city of Cleveland. This was a natural extension of the work of the Swetland Center because we know environmental health is structured by policies and systems. In November 2021, Michelle B. Jackson, a community researcher with the Swetland Center and a 2021 Food Systems Change Fellow, co-authored an op-ed that was published in the Plain Dealer. This piece concludes with a call to Mayor Bibb and his administration to lean into the mantra that Cleveland can't wait for food justice. The Food Systems Change Fellowship also served as a professional stepping stone for 2 of the 2021 fellows. Ms. Antonesia Harris was appointed to serve as the Community Engagement Coordinator for Midtown Cleveland's community and economic development work, and Ms. Kelly Etheridge was appointed to serve as the nutrition educator for Food Strong, a local nonprofit seeking to strengthen and empower communities through fresh local foods. These accomplishments affirm our commitment to training the next generation of environmental health leaders who will bring insights about community system science for environmental health equity into different sectors of action. And I'm delighted to share hot off of the press good news with each of you today. We learned last week that the Foundation for Food and Agriculture Research, the lead funder of our prior food systems change research, is going to fund us for another 3.5 years for a new study that we're calling Nourishing Neighborhoods, Empowering Communities, shortened to be the Nourishing Power Study. I'll be sharing a lot more about this new study in the coming weeks, including information about the full set of funders, since the grant we receive from the Foundation for Food and Agriculture Research requires a dollar for dollar match. In short, this is a systems level intervention aimed at incubating and catalyzing community-driven food systems change to advance nutrition equity. Nourishing Power will be co-led by the Swetland Center, Neighborhood Connections, and the FAIR Project. So 2021 was a year that helped us see the role we can play as an academic research center. The metaphor of stepping stone suits us well. We can link and bridge and connect in ways that lead to multiple paths that collectively move the needle on environmental health equity. At this point, I'd like to turn it over to Rachael, India, Tim, and Sheena for them to share another story from 2021, highlighting our journey to center racial equity and community engagement in the work of the center.
Thank you, Darcy. And before I jump in, I just wanted to take a moment to recognize some other folks in the room who have been a big part of our process along the way. We have Dr. Judy Lubin with us, who is from the Center for Urban and Racial Equity, which you'll hear more about today and really inspired our journey from the beginning. Carlos Lewis Miller, who worked with us several years ago at the very, very early start of this, helping us really break down the community-based participatory research model and think about how we can use that model to assess ourselves in this journey. Ms. Marilyn Burns, one of our Food Systems Change Fellows and longtime partners of the Swetland Center, and then two folks who are not here today but were instrumental in helping us along this journey were Molly O'Brien and Aaron Phillips, two students who helped us conduct our assessments last summer and put together the plan that you'll see today. So there's many more also that I can mention, but those are some folks I just wanted to highlight for our group today. So thank you for joining us today. This month marks a year since we started on our path to look deeper at our role as a center and how we can move from our promise of addressing racism and our role in partnering with our community members and how we can put into practice a plan of action to move from the status quo to an engaged effort to leverage our privilege and resources as a center to partner with the community to interrupt policy, practices, and research that does not truly recognize value or elevate the power that exists in our community. We're going to hear more about that journey today, and we invite you to partner with us as we explore where we are going from here. First, I wanted to share this quote and a little bit about Faith Spotted Eagle. She's a member of the Yankton Sioux tribe who attempted to block development of the Keystone XL pipeline and the Dakota Access Pipeline. In the 2016 presidential election, she actually became the first Native American to receive an electoral vote for the President of the United States, as well as one of the first two women to receive an electoral vote for President of the United States. I recently had the opportunity to watch a recording of her speak to members of our university back in 2018 through a series hosted by the Social Justice Institute, and she shared the concept of studying up in a university setting, which I think is really good framing and language for what we're trying to do at the Swetland Center. She says, part of being an ally when you study us, it's important to study up and not study down. That's a common word people recognize. If you study down, you're looking at people as victims and you're studying about them in their community without asking that community permission to study them. If you study up, you can see how they were subjected by those systems of violence and study those systems and violence and talk about them, so we learn that we don't repeat them, because many of those were education systems. We know that the university system has traditionally become complicit in the oppression and dehumanizing of our Black, Brown, and Indigenous communities here in Cleveland and beyond. We have heard from our community research partners how tiring it can be to feel used, abused, and mistreated by the system that so many of us here are part of. At the Swetland Center, this is not a legacy we aim to maintain, but a structure we wish to disrupt. We want to be authentic partners with our community in research to advance environmental health equity, especially our Black, Brown, and Indigenous communities. But how can we make sure we do this without repeating the same mistakes of those before us? So our journey to understand our space and place in addressing what we can do and should do to both improve our methods of authentic partnership with the community and disrupting structures, systems, and processes that perpetuate racial oppression comes in three parts, using the study up approach inspired by the wisdom of Faith Spotted Eagle. So the first piece is research. In February 2021, we had the opportunity to engage in a different kind of research in the form of a learning collaborative hosted by the Center for Urban and Racial Equity, and began to explore these questions like, what do we still need to learn? How have we contributed to or failed to intervene where we could? And what tools can we take advantage of to look deeper in our center to help us to move from being a bystander to an advocate and ally? Reflect. Using the lessons we learned from this collaborative, we spent the summer of 2021 conducting a center-wide community engagement and racial equity assessment to reflect on the places we have an opportunity to make change. And lastly, action. This whole process has helped us identify priorities for where to take action, which you'll hear more about today. As we look forward to the implementation of this plan, we also want to know how can we create short-term and long-term impact, and how can we partner with others. This whole process of studying up is not a one and done situation, rather a cycle. As you see here, this circle, it's continuously repeating, and we continue to seek to heal a long history of wounds inflicted by colonial structures that continue to evolve in new ways that we must confront if we want to work towards our mission of racial and environmental health equity. So let's dig a little deeper into that first step of the study up approach and our learning experience in the Center for Urban and Racial Equity Learning Collaborative. As I mentioned, myself and Tim and India, who you'll hear from more today, participated in this collaborative. And a little bit about CURE. Again, thank you, Dr. Lubin, for being here. We're so honored. CURE partners with people and organizations to advance equity and justice through policy, systems, institutional, community, and societal change. As you can see below, there are 3 focus areas for their work: transforming institutions and organizations, generating action and policy research, and promoting equitable policies and community change. Some of the objectives that we had as part of our collaborative included building a shared language and analysis of institutional and structural racism and engage in our own self-reflection, applying a racial equity organizational change framework to align policy practices, programs, and services with a deep commitment to racial equity and justice. And that's, you can see the change framework here on the screen, which really helped us operationalize what our priorities are and how that can look as we create change in our center. We also were able to work on some facilitation methods to support others in their own self-reflection, identify strategies for integrating trainings, assessment, and action planning in our organization, and develop relationships with our peers. It was a peer cohort. So this has been really useful as we move forward in our work as a center. But next I want to turn things over to India, who's going to take you through our process.
Thank you, Rachel. So next we'll take a deeper dive into our process of taking our newly acquired skills from CURE to assess community engagement and racial equity at the Swetland Center. So we took a 2-pronged approach to gathering information and data, one of which was derived from stakeholder interviews and the other derived data from the document assessment tool. So the interview assessment was a compilation of interview guides from the community-based participatory research model and the Cultural Competency Self-Assessment Guide for Human Service Organizations from the Cultural Diversity Institute from Calgary, Alberta. In total, we interviewed 16 key informants, including Swetland Advisory Council members, affiliated faculty, community partners, staff, and trainees. The assessment conducted by the Swetland Center was not only comprised of targeted interviews, but also a document review. And this tool was provided to participants of the CURE Learning Collaborative. And the purpose is to examine to what extent the organization explicitly or implicitly communicates a commitment to equity and how the documents can be improved to strengthen this commitment. And as you can see on the left-hand side, this is what the tool looks like. It's a straightforward identifying what domains of the organization are being assessed, documents that should be reviewed, questions that should be asked while reviewing the document, and an equity analysis question which explains why this question is important. Users of the tool then identify strengths, gaps, and any other key commentary. So after we conducted key informant interviews and a thorough document review, we decided it would be best to share our findings with the entire Swetland team and affiliates in a 3-session retreat. The first was a quick half-hour pre-session where we built shared common language. Throughout our retreat, we wanted to be explicit in the terminology we used. Therefore, we deemed it necessary to share the definitions presented by CURE of race, white supremacy, racism, anti-Blackness, colorism, implicit bias, and racial equity to make sure everyone is on the same page. We also discussed some lived experiences about how we've been impacted by implicit bias and structural racism. In the first session of the retreat, we reflected on the mission, vision, values, and approach of the Swetland Center. We revised the mission statement to include more explicit language about racial equity. So our new mission statement reads, The mission of the Marianne Swetland Center for Environmental Health is to study the complex interplay between environmental determinants and population health outcomes. The center places special emphasis on community-engaged approaches that address the role of structural racism in creating and sustaining environmental health inequities. We seek to translate these findings into policies, practices, and relationships that promote community and population health equity. And you can see here the new terminology is highlighted in red. In the second session, we revisited our values and decided to break into groups to come up with clear definitions for our values. In addition to the original 4 values, innovative, community engaged, collaborative, and inclusive, we added a new 5th value for racial justice. And we defined our racial justice value as: we believe in partnering with the community to build sovereignty and promote environmental justice by sharing power, igniting change, and dismantling racist structures. We seek to enact research, community engagement, training, and education that heals historical scars and ongoing trauma of structural racism. So we also broke up into groups again for racial equity action planning. We filled out a worksheet to help brainstorm recommendations that will be impactful in our journey to refine our community engagement and racial equity approach. Once the recommendations were collected on our action planning tool worksheet, we asked our Swetland team and affiliates to rank them by priorities. And next, Tim will share more details about how we plan to operationalize these recommendations.
Okay, so now we have a foundation of relevant information. We've discussed possibilities and asked for input and ideas. And now what? What are we doing? How are we going to take action? What are the tangible things that we've started, and what bigger things can we do? So some of the initial actions we've taken have already come up today, but let's start to go through them just so we have them all laid out. First, we updated the Swetland vision and values, as you just saw, to better reflect our commitment to community engagement and racial equity. Then we launched a book club. We're joining the Social Justice Institute for our next book, Braiding Sweetgrass. That's another really good one. We started with Farming While Black. The next thing we did was we included community research partners as co-authors. So official co-creators on peer-reviewed publications, which hasn't been done in too many places. We also raised the public profile of our community research partners. And we did this obviously with a lot of help from other folks. We published an op-ed in the Plain Dealer. Thank you, Richard Andrews, for helping us do that. There was a local news feature that involved Michelle and Darcy. So we've moved on that area as well. And finally, as Darcy mentioned, we've obtained new funding to advance community-led interventions. The Nutrition Equity Fund, or the Nursing Community Study, basically has researchers as guides and evaluators rather than project owners. So thank you to Darcy and Brooke and others that put a ton of work into that. Okay, so more actions. What are our 3 priorities moving forward? Okay, well, we plan to elevate support, recognize value, and hone our skills. So just to hash that out a little bit more in depth, what does elevate support mean? Well, we intend to elevate support for Black, Brown, and Indigenous community research partners to build and sustain trusting research partnerships and promote community-driven solutions that advance environmental health equity. Okay, so that's our first priority. The second priority related to value, we intend to recognize and value the efforts, skills, and knowledge and experiences of Black, Brown, and Indigenous community research partners to promote shared power and research relationships and cultural reinforcement. And for honing our skills, this priority involves building capacity among center leadership, staff, and trainees to acknowledge and address structures of racism and other forms of oppression to advance health equity through system-level transformation. So a lot of words, but all of them were important, so we laid them out. So how do we operationalize these three priorities? Essentially, the team broke them down according to the Engage for Equity framework, and there's the link there. In brief, this involves goals, learning outcomes, action outcomes, impact outcomes, and long-term impacts. The goals are basically tasks to accomplish. The learning outcomes are obviously things to learn. Action outcomes are results we expect. Impact outcomes are the wider impact, and the long-term impacts are fairly self-explanatory. They're long-term impacts. Okay, so in the interest of time, we're just going to provide one example of one of the priorities so you can see how we broke it down. So priority 2 is recognize value in the efforts and skills of Black, Brown, and Indigenous community research partners. So breaking that down into goals, the first one was to promote equitable compensation for Black, Brown, and Indigenous community research partners. And the second goal is honor community knowledge in research, procedures, and decision-making. So 2 goals. In terms of learning outcomes, this flows out into identifying the best practices for fairly compensating community researcher engagement, and creating a space for dialogue and listening and mutual ongoing learning. So 2 learning outcomes, 2 action outcomes as well. Establish equitable partnership agreements with community researchers on research endeavors, and increase community involvement in research and co-learning to generate a more bi-directional process. Okay, so for impact outcomes, overall, shared power relations in research, enhance the Case Western policies to honor the community researcher role in research, and finally, enhance our overall research productivity. So when you follow that whole path, the long-term impacts we're aiming for are community transformation, social justice, and environmental and racial health equity. So there it is all on one sheet. You can see how it all flows together. And obviously we don't have time to go through the other 2, but that gives you a flavor for how we did this. Okay, next slide. And we'll be happy to take any questions for the team.
I have a question for you guys. How will people be able to sort of see what the full report looks like in terms of the action plan?
I can answer that. So we are in the process of translating our plan to our Swetland Center website. You'll be able to find it kind of in the About section where we have our mission and vision and values. And we plan on keeping it a living document. So you'll see the goals and objectives that were identified in collaboration with our partners. And then as we go throughout the next 2 years, we're going to be updating it to update everyone on what activities have been happening to operationalize those goals and objectives. And we welcome everybody who's interested. If you are interested in being a part of that implementation, please direct message me or email me and we can get you connected.
I have another question. Just looking at who's in the room here, are there, and maybe even Dr. Lubin, you could comment as well, are there high-level lessons learned or recommendations that you have for other groups that are sort of realizing that they need to do more explicit work to affirm their commitment to racial equity and community engagement?
I mean, I can start and anybody else can jump in. I think one thing is, one thing we said when we started this is how overwhelming it can all be, and it feels like it's never done, and that's because it is never done. So I think taking a thoughtful and intentional approach instead of focusing on trying to like check boxes and make sure we're doing everything right. Sometimes the best approach is the most like vulnerable and honest approach and saying like, we don't know all the answers. we haven't figured it all out, even with the plan now. Like, there will probably be things that come up that we didn't think of or that we want to add to it. And like, that's okay, as long as we are open and honest about that, and that we are willing to pivot or be flexible, and taking the time that's necessary to hear everyone who needs to speak and share and give their wisdom to us. Time, we're all pressured for time, but this is one of those spaces where you need to take the time.
I have a question. So thank you for sharing. This is very exciting, and it is, yes, new territory. So I really commend you for jumping in and doing what is right. I noticed that part of this, as a consequence of your collaboration, you're building tools that the university can then use so that others like me trying to do collaborative work with communities, then maybe kind of you're opening the way for these tools to become more available for the IRBs to have a better understanding of these new ways of doing research. And so I was wondering, are you planning on presenting on campus? How are you going to share this so that it drives more people to do it? And I think that that has a huge potential to create change in the way in which we do research.
I'll just make a comment on that, and I see Dr. Lubin also brought her face on, but I, just listening today and hearing your comment, Francisca, is, I'm wondering if we would want to organize a half day session. This is like sneak peek seminar. We can't tell you everything. Maybe even bringing in Dr. Lubin to campus and having people learn. I mean, I don't know if what that would look like, but I agree with you. One thing we've learned, and back to that stepping stone, it's the series of all of us. All of ours are going to look different, but there's probably some commonality as well. And there's we're going in different paths in different directions, but they're all bridges. And I feel like maybe there is an opportunity for a university-wide, almost like a workshop if people were interested in coming. And so I want to turn it over to Dr. Lubin quickly because I see your face.
Good morning. Thanks so much for the opportunity to contribute to the conversation. I'm so excited to see the work and the progress that the team has made since the cohort last year. We had the pleasure to work with India, Rachael, and Timothy as part of the collaborative that CEREA hosted last year with a few organizations. And your question, Dr. Freedman, around being explicit and sort of like what are things to sort of expect as you're moving into this process where you're really implementing the plan. So we've worked with a lot of different organizations, different types of organizations and institutions, and it is a journey, right? Like we always talk about racial equity as a journey. There isn't one clear destination or point that we're seeking to arrive at. And when we get there, there's going to be more equity and justice work for us to be doing. And so one of the things I encourage folks is the action planning process, just even as you all have described it, is, it's work in and of itself, right? To work through the bringing of partners, opening up conversations and dialogues that possibly haven't happened before among Swetland stakeholders and community members. And so I do want us to acknowledge the labor that was involved to get you to this place. And sometimes folks are a little tired after developing the action plan. And so encourage the core team to take a breath. And then this is also when the work really happens, right? Is that now that we have an action plan, now we have to implement. And this is change work and systemic work and community involved, community led work, right? And working in collaboration with your stakeholders. And so We want to acknowledge the labor involved. We want to acknowledge that it takes time for change. And at the same time, that we also want to honor any small wins that happen along the way. That's also very important. And sometimes, you know, we sometimes feel, we hear folks feel a little funny about that like we don't want to congratulate ourselves on the back for doing necessary and important work and often urgent work that needs to happen. But we also want to acknowledge when we're making progress, that I think is so important, because sometimes we do see client partners that momentum starts to die down a little bit after the action plan, and you start getting in and digging in. Is how do we maintain momentum? How do we maintain the energy? Is to acknowledge those wins, lift up the voices of community members as much as possible. Leading in this process, I think, is also very important and critical. How are we always looking at ways that we're shifting power? How are we as institutional leaders, institutional agents, making space, you know, ceding power and giving way? Those are the types of changes that I think can also be very invigorating, I think, to really see how when we make space, and we don't have to be the ones in leadership, like we're really working in true co-ownership and partnership with communities, I think is really what this work is about, how we begin to change institutions. And on the question of being more explicit, I didn't get that sense from the team that was a challenge, right? But certainly we've worked with groups where, you know, they've struggled to say this work is going to focus on Black and Brown and Indigenous people, right? Like sometimes that is the first step, is saying, like, really identifying who this work is going to, who are we accountable to in the change process, who are we working in partnership with, and really keeping that at the center of the journey as you move forward. So that move forward is that explicitness is who we're primarily accountable to, and what are the changes, very specific changes that we're seeking to make. And then the last thing I'll mention is around accountability, and that is really what the action plan is about, is accountability. Is that as much as we go through a process of learning, building shared language and analysis, and saying and articulating a set of steps that we're going to be implementing, but that the action plan is to have measures of progress, right? And that is important, that the action plan is being shared publicly. So that is an invitation to everyone that's here to view the action plan, to touch base with the team, to be in conversation as you all are really trying to bring this action plan into life, which is ultimately to change the outcomes and to advance environmental justice.
Thank you, Dr. Lubin, for sharing your wisdom with us and spending your valuable time with us. For context, I sent Dr. Lubin an invite maybe like a week and a half ago, and I'm like, wait, we'd love to have you here. And I know she has another commitment today, and so we're just so grateful for your time and really helping us to get started on this journey and thinking about where we go from here. And I think your words are very encouraging to those of us who have been working on it, because it is tiring and it's emotionally exhausting, and you wonder if you're doing it right or where to go next. So we're grateful and thank you. And with that, I'm going to actually turn things over to Sheena, because we're going to jump into our kind of more engaged part of this discussion.
Good morning, everyone. If you could do me a favor, I've placed a link in the chat. If you could click on that link, we're going to ask those in attendance to join us in an interactive activity where we'll be able to discuss our goals around our 3 priorities. As a reminder, those priorities are to elevate support for Black, Brown, and Indigenous community research partners, to build and sustain trusting research partnership, and to promote community-driven solutions that advance environmental health. Our priority 2, to recognize and value the efforts, skills, knowledge, and experiences of Black, Brown, and Indigenous community research partners, to promote shared power in research relationships and cultural reinforcement, and to build capacity among center leadership, staff, and trainees to acknowledge and address structures of racism and other forms of oppression to advance health equity through system-level transformation. Now for this activity, we will be using Miro, which is a digital real-time whiteboard to answer questions about ways to meet these goals. Now, as we look at our priorities, do you have the slide up for me, Rachel? As we look at our priorities and goals, what should we focus on in 2022? What ways are we to can turn the 2022 goals into actions? And how does this synergize with goals or partnership? Now for this activity, in order to use the functionality of Miro, being logged into a computer is recommended since there may be different functionality with the link through the phone. However, the breakout rooms will be facilitated by the three of us, me, Tim, and India. And so if there's any questions that you may have or comments, we could surely help you with that. And again, whenever you're ready, please visit the link posted in the chat. Okay, and I can share my screen just to go over some instructions. I see people there already. This is great. Okay, if you could see my screen over here, there's some brief instructions on how to use this board with your mouse. You have these functionalities over on the side. If you want to pan the screen, you get the hand, you can pan the screen. If you want to use a sticky note, these are the sticky notes here. Any other tools that you might need, you can just scroll through these tools here. If you need to use a comment, this is the comment portion. You're going to be able to self-select the breakout room that you want to be in. And once you do that, if you want to center on that particular breakout room, you go to this button here, frame, click on that breakout room. It's going to bring you right there. Okay. All right, we're ready.
Okay, I will open the breakout rooms really quick. And so you'll see all three rooms will be open for you to select whichever one you would like to go in. And there'll be a small black box at the bottom of your screen that instructs you to choose a breakout room. So all rooms are open. And you should be able to join whichever one you'd like.
All right, as folks are getting back in the room, I know that wasn't a ton of time, but hopefully it was enough to get the juices flowing and some ideas going. We very much appreciate your feedback and wisdom as we continue to guide our process. And I said to my group, and I'll say to the rest of the group, we will leave the Miro board open. So if you want to go back and add comments or even look at some of the other boards that you were not joined with, you can jump in there. We'll probably send out a follow-up after today's session to all the participants with the link to the recording, all the other links we shared, and the Miro board. So I'm gonna just go ahead and turn things over to Darcy to close us out for today.
Great. Well, thank you all so much. Thank you for the labor, the hard work, truly, that has gone into getting us to this point. And as Dr. Lubin said, that, you know, we need to acknowledge and celebrate the things that we've done along the way, the successes, the momentum builders. We often say low-hanging fruit, but Dr. Lubin sort of encouraged us to say momentum builders, because those sort of propel you to the next step. I think that what you can see here is that there is definitely a committed group interested in working to figure out how can we do better? How can we ensure that the assets and opportunities that are available through the Swetland Center are available to everybody? And we know that there is absolute brilliance and innovation to solve some of the pressing environmental health problems. And it is our goal as a center, our commitment as a center, is to leverage this amazing resource we have to be that bridge, to be those stepping stones, knowing that folks may only be on one stone for one bit, and then we might see them like Carlos and Rebecca. I saw their wedding picture on here. Go on to do other things, but know that we are connected in the journey. And I'm excited to be here with you today. I'm excited to see where this takes us and to see how it evolves. I want to share Rachel's request. If you want to continue working on the mural board, please do. We'll send that out, and I wish you all a great day, and thank you for this time together with us.
Thank you, guys. Have a wonderful day, and we appreciate your time. Take care.
Thank you.